Hi everybody, this is Mark and I'm going to teach you how today to inject an interphalangeal joint of the hand. I know I have a knee model here because it's enlarged and it's largely the same joint with the exception it doesn't have a fibula bone and it doesn't have the meniscus on the inside of the knee, but ostensibly the anatomy is pretty much the same except the direction that the ligaments travel. But the bony anatomy is essentially the same for teaching purposes for an injection. There's a couple ways to approach an injection of a joint. You can try to sneak a small gauge needle in between the bones, and I find that to be very uncomfortable for the patient. And it's pretty much luck if you get in there, and it's a lot of work, and you can really scrape up the cartilage in doing so, and the patient doesn't send you a Christmas card for that. It's an uncomfortable shot to begin with, so I always numb it up first with some lidocaine without epinephrine. And I find the shot always easier if you approach it from the dorsal part where there's less pain fibers, and also just you could always feel the flare. And the flare usually begins right where the creases start to show up on the skin. And then so if you run your fingernail, you could always feel the beginning of the flare of the distal end of the articular surface, the proximal, middle, or distal phalanx. It's all the same. You can feel the flare with your fingernail. And that's the beginning of the joint. And certainly the joint capsule comes all the way up to above that point anyway. So really all you have to do is get into the joint capsule, and you're getting into the joint without trying to finagle your way into the articular surface exactly. So that's what we're going to teach today, an injection from the dorsal part. It's the patients like you better, and it's easier on you. And what's easier on you is easier on the patient. So we have a nice lady here who's going to have an injection into her interphalangeal joint of her thumb. You can see the spot that I've already numbed it, and that is where I palpated to be the beginning of her flare, right? Every time you enter a joint, I'm not a super fan of just alcohol, although she was cleaned with alcohol. I'm a much bigger fan of chlorhexidine, which kills bacteria on contact. You don't want to be responsible for introducing bacteria into the joint, particularly if they're diabetic or immunocompromised in any way. And then there's, of course, alcohol mixed with this chlorhexidine, so we're going to let it air dry a scooch. You have to be a Boy Scout, get your Band-Aid ready to go. I always use betamethasone or Kenalog. Betamethasone is favored by me because there's less particulate. Every time I do surgery on somebody who's gotten Kenalog injections, I found white deposits in and around the joint if the non-surgical treatment didn't work. And I don't like the white deposits in there. It suggests to me that for some reason that powder's not being absorbed. And therefore may not be as effective. So my drug of choice is betamethasone. I've never seen deposits in a joint from that. And so she has a half a cc because that's about what this joint will handle. So I'm going into the spot that I previously numbed. I go right down to bone. I know that I'm right at the flare, and therefore I'm in the joint capsule. I could put my finger next to the joint capsule, and I can feel it distending. And that's simply all we have to do. It's a more painless approach. Your Band-Aid's ready because erythrocytes often show up. Of course, I didn't use lidocaine with epinephrine on a digit, and that's a simple shot, and that's the more painless way of doing it. With or without blocking it first, it's overwhelmingly the more painless, and there's no chance you're going to do damage by trying to snake your way into the sides of the articular surface. Even if you try to do that and pulling on it, an old trick to increase the gap, it's not nearly as effective. So I recommend you try this approach, and you'll make friends with your patients, and you'll give effective shots. Thank you very much.